So good morning, everybody. Thank you for joining Axxess for this webinar on review choice demonstration. So just to give you a little quick background on Axxess, we are the fastest growing home health care technology company. We provide easy to use, complete suite of innovative cloud-based solutions that empower healthcare providers like yourselves with solutions to make lives better. So we are, by more Medicare certified home health care organizations, Axxess is trusted in order to power their operations over any other software. Joining us for this webinar is Krisdee Foster. She's the Senior Relations Representative from Palmetto GBA, Medicare Administrative Contractor. Krisdee began her career with Palmetto back in 2002. As a Senior Provider Relations Representative in the Provider Outreach and Education Department, she was responsible for providers in 16 states where she conducted home health and hospice workshops for Medicare providers. Today, she is a Senior Provider Relations Representative for the pre-claim review process, review choice demonstration. And with that, ladies and gentlemen, I give you Krisdee Foster.
Thanks, Stephanie. I'm going to pick up my phone so I don't get an echo either. Good morning, everybody. Thank you for joining us today. I'm so thankful to Axxess for giving us this opportunity to be able to speak to all of their providers about the review choice demonstration so that everybody can be aware. One of the first things I wanted to say prior to this starting is that some of you may have seen on the Palmetto GBA website that they still do not have a start date for the state of Illinois. I know that that is one of the questions that has been asked. You can find that information on www.cms.gov. All they did was send out about a 4-sentence little blurb that said they're still waiting on the PRA approval, and once that is given, they would of course be issuing the date for Illinois and then the other states to follow at some point down the road. And so with that said, we're going to go ahead and do our education like we have been, meaning that we are still educating. This is still a go-ahead. We haven't been given that this is going to stop. It is just simply them getting the dates together on when this will actually start. So thank you for being on. Thank you for continuing the education so that you can be ready as soon as that date is given. This slide is just a disclaimer slide that we put on all of our presentations, which simply says all the information that I'm giving you as of today is correct. As you all know, that can change, but as of today, that is the correct information. As a background, if you are new to this and you were in a different state other than Illinois, you may not have been following along with the PCR demonstration that began a couple years ago. That pre-claim review demonstration was put on pause April 1st of 2017. Basically, they just had a lot of congressmen, senators, some people with CMS. Everybody wanted to make sure that this information and this demonstration was going to benefit CMS on what they were trying to do, which was protect the Medicare Trust Fund, but also that it was not going to be burdensome to providers. So they went back and revamped the program, and that is why it has now come out as pre-claim review for your review choice demonstration. So pre-claim review is still a portion of RCD, but the whole program itself, or the whole demonstration, which is a 5-year demonstration, is actually review choice demonstration. And we'll go through what those are, what the choices are, what makes this a different program than before. You're probably aware that some of the states had changed from back when it was pre-claim review. Some of them left and some of them have come on. It is a 5-state program right now for Illinois, Ohio, North Carolina, Florida, and Texas. Again, this is a 5-year demonstration program, and at the end of 5 years, CMS will determine whether or not this helped to do what they wanted it to do, which is reduced fraud and, of course, save money for the Medicare Trust Fund. And if it did, it's a possibility that this will be rolled out to all the states. One important thing to remember is during the review choice demonstration, this program does not create any new documentation requirements. So all the information that you've had to have gathered when you have a home health patient come on, you do your intake procedures as usual, you gather the information, meaning your certification, face-to-face, all your signatures, all those things are important, and you should have those in your documentation prior to submitting anything to Palmetto GBA. RCD doesn't require anything different. You still should do the same intake procedures, get that information to us, and then submit either for PCR or one of the other choices prior to submitting for your final claim. Each home health 60-day benefit period episode is reviewed under the review option, which you will choose. And those home health services for less than 60 days will still require that information, with the exception of the low utilization payment adjustment, otherwise known as your LUPA. You want to make sure with LUPA is that you know that it is truly a LUPA that you're looking for or that you're looking at, because if it's not, you want to go ahead and send that information in. Each claim for a 60-day episode where PCR option was chosen, but let's say you did not submit for PCR, so you chose pre-claim review, but you didn't send it in for whatever reason, then you are subject to prepayment medical review, and if it's payable, a 25% reduction. So once you make your choice, make sure you're sending that information in. Most providers are familiar with the e-service portal for Palmetto GBA. If you're not, we recommend that you go out there, get familiar with it, and sign up. It is completely free. The reason why you need to go ahead and sign up for it is this is the only way that you're able to make your selection. That link for e-services is right there on the screen. You'll be asked to select from one of the 3 initial review choice options for medical review, and then if you qualify for subsequent review, you'll be asked to make those selections as well. You want to make sure that you read each option thoroughly prior to making your selection, because some of these selections require you to stay with that selection for 5 years. All the other ones, you're able to go back and forth each 6 months if you decide to. So let's look at what it looks like to make your review choice selection. If you notice on this screen, once you log into e-services, and again, if you do not have access to e-services, please go out there and go ahead and sign up. You'll choose a username and a password. You do want to make sure that you have 2 administrators. You have a regular administrator and then what they term a backup administrator. This is important because if your administrator leaves and you don't have anybody as a backup administrator, no one can get into your information. So make sure that you choose both. And if you are in e-services and you have not chosen a backup administrator, make sure you go out and do that as well. You are able to give access for the e-service information to anybody at your place that you would like. You can give them a username and password, and you're also able to decide which access they have to that information. So if you want them to be able to have all the information, you can choose that, or if you just want them to have review choice information, you can choose that as well. So once you log into e-services, this is what the review choice selection page looks like. At the very top, you'll notice in the grayed out boxes, that's the information that will already be pre-populated for you, your user or your provider name, your PTAN, and your MPI. Underneath in bold, you see review choice as of. That is what's telling you the choice that you made last. So if you notice below that, these are the 3 initial review choices: minimal review, pre-claim review, or post-payment review. And each one gives a brief description underneath. This is where you're going to go in and choose the choice that you want for that 6 months. You will click on the choice that you choose and then save. If you also notice next to the save button, there's a view history button, and we'll talk about that in a minute, but you can go there as well and you can actually view what you've chosen in the past for pre-claim review or for the review choice demonstration. So you can see what your choice was and who made that choice. Now, I talked about initial review versus subsequent review, and we're going to talk about that in detail in a moment, but just so you can see it on the screen and know what I'm talking about, if you notice at the bottom where it has the 3 choices, and I said that these were the initial review choices, this is for all providers in all states that meet the initial review selection choices, meaning you just came onto the program, so Illinois is the exception for this. So all the other states, you come onto the program, these are the top 3, these are the 3 that you are going to be able to choose from. In the subsequent episodes, so 6 months after that, when you are going to make another choice, you could possibly be in the subsequent review options. And I said Illinois is an exception because Illinois already has a threshold that they met. They already have an affirmation rate based on when they went through this demonstration a year ago. So they will be receiving a letter at some point that will give them their affirmation rate of what they were previously. If you do not receive your letter, Don't worry, if this goes live prior to you receiving that, it's not a problem. When you go on eServices, this choice where you see here will only give you the 3 choices, either the initial choices, or if you meet that threshold, it will give you the subsequent choices. So you can never make a wrong decision on your choices. So providers will choose their initial review selection prior to the implementation in each state. And again, you want to make sure that you are making a choice. Otherwise, the system will automatically assign you to participate in post-payment review of all your claims. Now, this slide right here is a little bit misleading today because, as you can see, it's not very helpful. Number one, there aren't any dates, but the 12/10 implementation date, which was no earlier than 12/10, obviously that was yesterday, and with the release of CMS's information on their website yesterday, they have said we do not have a date for Illinois yet for their selection or their implementation, but we expect to have that soon. So make sure that you're checking back for those dates. So I talked about that there are 3 initial review choice options. You have your pre-claim review, your post-payment review of all your claims, and minimal review. We're going to go through what each of those are in just a moment. But I also mentioned that if you meet a threshold of 90% or higher for your affirmation rate, you could possibly have the subsequent review choice options, which are your pre-claim review again, selective post-payment review, or your spot check of 5% of your claims to ensure continued compliance. So I kept mentioning this affirmation rate. If the home health agency's full affirmation rate or claim approval rate is 90% or greater for a minimum of 10 claims during that 6-month period, then you can choose one of those review options. You can start or continue participating in PCR for those 6 months. You can choose the selective post-payment review of a statistically valid random sampling of claims for the 6 months. Or no review other than the spot check of 5% of your claims to ensure continued compliance. So let's look at what those initial review options apply to. The first one is PCR or pre-claim review. If you're an Illinois provider, then you're very familiar what pre-claim review was. Not much has changed. It's pretty much the exact same thing if you choose PCR. For those states who are new to the review choice demonstration, PCR applies to type of bills that you see on your screen. These are all final claims. The majority of you are familiar with the 329 because that's your typical final claim bill. It also applies to these HCPCS codes. Now, if you notice, last time in PCR, some of these HCPCS codes changed. CMS did away with some of them, combined some of them, so these changed. So you want to make sure that you're staying up to date on these HCPCS codes or that you're billing through ESERVICES with Palmetto GBA because that drop-down box that gives you all of the HCPCS codes, it is updated as they are updated. One thing you want to remember is that RAPs are not included in this demonstration, so there is no changes in the RAP submission process. They can be submitted as usual, and there are no changes in the processing and the payment of your RAPs either. Remember that RAPs can auto-cancel, which means when you haven't submitted the final claim timely, under the PCR option, it's the same thing. So you are given the greater of 120 days after the start of the episode or 60 days after the paid date of the RAP to submit your final claim. It's the same thing with PCR. So if you you do your normal intake procedures, you have a provider or a beneficiary come on, a home health beneficiary to come on, you do your normal intake, which normally means you drop your RAP pretty soon. Well, that is where the clock starts so that you don't auto-cancel. So once you drop your RAP to us, and once you have the information needed, like your face-to-face and any of your signatures that you have, you would go ahead and submit for PCR. Once you submit to PCR, you will be given the information back if it is affirmed or non-affirmed. During that time, you're also able to resubmit. But again, you still want to be able to do this PCR submissions and resubmissions in between that either 120 days or 60 days so that your RAP doesn't auto-cancel. So it is my suggestion that you get that RAP in as soon as possible and that you go ahead and submit for PCR as soon as you can to give yourself that leeway to be able to submit or resubmit as many times as you need. Under the PCR option, a request may be submitted for more than one 60-day episode for a beneficiary, and the PCR decision will indicate if there's any of those provisionally affirmed episodes. The provisionally affirmed term always confuses people because, and myself, because when you think of provisional affirmations, you think, well, they're not quite fully affirmed, but it is a full affirmation. So the reason it's called provisionally affirmed is because the MAC or Palmetto GBA has affirmed your decision, which means you're good to go. You can go ahead and submit your final claim. But it doesn't mean that another contractor wouldn't be able to pull that claim. So a UPIC, a RAC, anybody like that would still be able to touch that claim if they need it. It's not likely that they will, but it is possible. So the term is provisionally affirmed. A provisional affirmation decision is justified by the beneficiary's condition, may apply to some or all of the number of episodes that you requested. Only one home health agency is allowed to request PCR per beneficiary per episode of care. In a situation where a patient is discharged and readmitted to the same home health agency during that episode, then a new PCR request would not be needed unless a separate claim is going to be filed. So there are 4 ways that you can submit your request for PCR to Palmetto GBA. You can send it in through ESERVICES, which is our preferred method of submission. The majority of Illinois providers did utilize the eService portal for this. 1, this time you already have to have eServices in order to make your review choice. And 2, it is the only way that you are guaranteed, 1, that you get a note back or a message back that says we have received your information. And it's also the only way that when you submit for PCR, that you are not going to get a incomplete. And we'll talk about what the incomplete is in just a moment. You can also send it through the electronic submission of medical documentation, or ESMD. The link there for CMS is there. It is basically their version of an eService type portal. But just keep in mind that if you are submitting through ESMD, there are some things that you won't be able to do, like submit for multiple episodes, and your resubmissions are a little bit different, where you're not able to send in a resubmission unless you have noted on the documentation it is a resubmission. eServices, you can just choose resubmission and it comes right in. You can also hard copy mail your information to us or fax it to us. Please be sure that if you're faxing it to us, that you indicate where you want it faxed back to. If it is not indicated on the fax form, then we cannot send it back because we can't send PHI without knowing that it is a secure fax. Also remember that if you are submitting hard copy, you are downloading a 15-page form that has barcoded on the very top sheet. You want to make sure that you have downloaded that, put in all the information you need, and that you submit that barcoded sheet just for the person that you are sending the information in for. If you reuse that barcode, whether in mail or fax, it will duplicate out in our system because it is meant for that beneficiary that you have put the information in for. As most of you know, it's a free internet-based self-service application, eServices, and this is the information on how to get to it. 97% of PCR requests in the PCR demonstration were submitted using eServices. That's for the state of Illinois, so most found that to be the most helpful. Home health agencies would complete an online submittal request that pre-populates the information. If you are submitting it hard copy, then you scan the supporting documentation, and if you're submitting it through eServices, you do the same type of things, and you just attach it in a PDF format. So you'd scan the documentation and attach it, and we're going to look at what that looks like. Make sure that if you are sending something in a PDF format, that it does not have a password protected PDF password that needs to be put on there. We had several of those last time, and we're not able to get into the documentation because we don't know your password. So make sure that you don't have that on there. Once that we receive this into our system through eServices, you automatically receive a message that's generated that says we have received your information or your PCR, and that you will be receiving a document control number, otherwise known as a DCN. That DCN is letting you know that it is in process, and it is the way that you are able to track your PCR through the system. You can attach individual attachments, or you can attach all your documentation in one and use the drop down or refer to box. So I will show you that in just a minute so you understand what that is. So this is what eServices looks like. If you log into eServices right now, you will not see the RCD link at the very top because we haven't gone live yet. As soon as we go live, this information, you'll be able to click on it and go through the RCD screens. If you notice at the top here, it says you have 29 unread messages. These are where your messages are going to come, which gives you your DCN, it gives you your unique tracking number or your UTNs, and any messages that come back and forth from the nurses to you. Once again, Palmetto GBA will be having nurse reviewers contact you. So you want to make sure you put the information to who to contact, and I'll show you where that is in just a moment. They will be contacting you as if you do not have if you do not get a full affirmation. So if you get a partial affirmation or a non-affirmation, they will be contacting you to let you know what is missing and what you need to do next. So once you click on the RCD link at the top, you'll be able to then choose pre-claim review submission. When you make this choice, the first 4 boxes are pre-populated for you each time. But this is where you're going to want to put that requester name and requester phone number as well as the email. This information needs to be the person that you want that nurse reviewer to call. So when they call somebody, please put that information in and their direct line if possible so that they can reach them. When you go onto the next screen, you'll be able to validate beneficiary information. Again, something that is unique to eServices so that you're able to submit this without having any misspellings or Medicare ID or date of birth issues. We are also this time asking for ordering and referring physician information and the attending and certifying physician information. This is simply to track those physicians that you're using, both ones that are doing the right thing and those that are, kind of give you a hard time about getting the information you need timely. So CMS wanted this information so that we're able to track those physicians and see what is occurring. The next screen is where you're going to put your start and end date in your type of bill. And this is where that HCPCS code drop-down box is. This is where I was saying this is really important because in eServices, if something changes or a G code changes or is added, it will automatically generate in our system, and you won't have to worry about whether or not you are billing the correct codes. If you have put in information that is incorrect, so your dates didn't match, you accidentally typed in a wrong number, as you can see where the red font is, it is going to give you an error message before you can go on to the next page to let you know what is incorrect and how to correct that. You'll go through each question in the dynamic tree. There is a user guide and checklist for the dynamic tree and the structural and functional impairments that you can download. But each one will give you the questions that you need to answer in a drop-down box. If you notice here on question 2, you'll see task 1 with browse. This is where you're going to put the information in that you need. So this particular one is asking for the face-to-face clinical encounter note. So you'd be able to click browse and then attach it just like you would a document or a picture to an email. You would pull up the face-to-face encounter note, or if you are attaching everything as one document, you would simply put the documentation in there and use the drop-down box to refer to which page for that nurse reviewer to look at. And I'll show you that in 1 minute. You'll go through all the rest of the information, and if you notice at the very bottom here, it gives you the error. This error says that the file eServices test attachment homebound 1 PDF is already attached. That's because this person is attaching things individually, which is fine, but they haven't renamed it. So if I'm having to put in my homebound information in more than one spot and I haven't done it all in one big documentation bundle and I'm attaching it separately, each time I attach it, I need to rename it something else to attach. This is that information I was telling you that if you decide to just bundle everything into one, you would be able to put that information in there. And if you see it says refer to another task, so you can refer to where that bundle was, and then it says the reference page. So if you want them to ensure that they are seeing the face-to-face or the homebound note or whatever, you're able to put that information in and the page number so that a nurse reviewer can go directly to that page and see the information that is needed. You'll go through all of the information, just like I said, going through eServices, answering each question and attaching where you need to attach. Then you get to this screen, which I always say is the screen that reminds me of when I do too much online shopping. You have your cart here, basically, which shows all the stuff that you have put in there. And if you notice on the far right-hand side of the screen, you have a orange remove button. If you have attached something incorrectly or you want to put something different, you can simply just hit that and it will remove that information. New with eServices for this time around with RCD is you're able to attach subsequent episodes. So that's a little bit different than with hard copy and mail. These have to be attached individually. It's the same with hard copy or faxing. I meant hard copy or fax. So if you are sending them in hard copy or fax, you still have to send them in individually. The same thing with eServices. If there's a subsequent episode, you would simply click yes. And as you can see at the top left-hand corner, it will say episode 2 information, and it will walk you through all the information for episode 2, and you're able to submit it that way. One of the features that occurred at the end of PCR the last time was our save feature. If you notice at the bottom left hand, you can choose save. It will make you answer certain questions or up to a certain point in order to save, but once it gets to that point, you're good. You can save it and you can come back and answer those questions if you before you submit that PCR. So you can take a break, go to lunch. If you have nurses that need to send in more information, you can go ahead and get started on those and hit save. Once you are done with everything, you would be able to hit submit. But if you have errors in your eService portal, then you would need to look to see what information has the errors, which shows you on this screen, and you simply go back and make those corrections. So as you can see, one of the things that eServices does is it doesn't allow you to go on to the pages unless you correct your errors, something hard copy wouldn't allow you to do. It also allows you to save that information and come back. So if you go to the top of eServices like we were before, so you've clicked on RCD, you'll notice at the bottom where you can choose RCD choice selection, pre-claim review submission, where you're making those submissions, or incomplete PCR request. This is the tab where all your information is that you have put all your saved incomplete PCRs. So you can go ahead and choose that and pull it up and finish your information. Once you submit for PCR, you are going to get this message that says we have received your PCR. It's been submitted successfully, and you'll be receiving your document control number. So this is your assurance that it has come into our system. If you send it in hard copy or fax, again, you're going to be receiving this same information back, hard copy or fax. I noticed, or I mentioned earlier, that eServices doesn't allow you to get an incomplete, meaning if you left something off or you put something incorrect, it's going to tell you to go back and make that correction, where if you submit hard copy, either with mail or fax, you don't have that luxury, so you could be getting that incomplete denial as well, which means that you'd have to go back and make those changes and resubmit. This is the front page of what that Palmetto GBA submittal request form looks like if you're submitting hard copy. Again, this is 15 pages. It's the same type of information as we just went through with eServices, but you would just be filling it out on your computer and sending it in to us. Remember that for the initial submission of the PCR request, MACs can make that decision and notify within business days, excluding federal holidays. Again, you are notified of an incomplete or a partial affirmation or a non-affirmation or your full affirmation. The decision notification will contain that unique tracking number or that UTN. That UTN is that number that you need to put on your final claim, and that's what processes in our system and says that we're good to go. A provisional affirmative decision is basically saying that you are fully affirmed and that likely meets those Medicare coverage. That decision applies only to the episode for which that PCR was submitted, and you're going to receive that UTN back and which of those HCPCS codes were affirmed. So with that said, if you if you get a partial affirmation back, it's going to tell you which HCPCS codes weren't affirmed and what you need to change. That nurse reviewer is going to call you and walk you through that, and you are going to put that UTN on your resubmission form and go ahead and resubmit to Palmetto GBA. Once that resubmission goes in, if it's fully affirmed, you will be receiving another UTN. If that new UTN is fully affirmed, you would put that new UTN on your final claim and be able to submit it in for payment. Again, a provisional affirmative decision does not follow the beneficiary. So if they go or transfer to another home health agency during that episode of care, the receiving home health agency would need to submit their own home health PCR request. The non-affirmative decision is if it is not meeting the Medicare requirements and more documentation is needed. Again, you will be receiving what we call a non-affirmed UTN. It doesn't look any different. It's still a UTN number. They're going to tell you which HCPCS codes were non-affirmed and a detailed explanation as well as that nurse reviewer calling. Those resubmissions of a PCR request can be done for those non-affirmed or partial affirmed decisions. You're going to want to make sure that you're submitting that information to us as quickly as possible so you're meeting those timely filing requirements. There is no limit to the number of times that you can resubmit to us. You just want to make sure you're meeting the timely filing requirements. You would select resubmission in eServices, and you'd want to put that UTN of the most recent non-affirmed decision on that resubmission form. Remember that providers submitting through ESMD must notate on their documentation that it is a resubmission for it to process correctly. On a resubmission, you'll notice the time frame has changed a little. So on initial submission, you have those 10 business days. On a resubmission, we have 20 business days, excluding federal holidays, to conduct that review and notify you of our decision. So although you're able to resubmit as many times as you want, you can see the time frame gets a little longer and longer, which shrinks your time to be able to submit your wrap and your final timely. So you want to make sure you're submitting that information as quickly as possible. Again, a notification is sent to the submitter for each of these that are received. And a notification is also sent to the beneficiary. So make sure as you're doing your education with your nurses that they are aware of this, because if you get a partial or a non-affirmation, that your beneficiary is also getting that information. And as we know, they can be confused and think that if they get this letter, that means that they are going to have to pay out of pocket for something when you are simply just going to resubmit. So you'll have to do a little education with them as well so that they don't worry about whether or not they're going to have to pay out of pocket for something. This just shows you how you submit for that UTN. It is a 14-digit UTN number, which is provided in that PCR notification. If you select or if you submit electronically, it's positions 19 through 32. And if you submit hard copy on a UB04 form, it's positions 19 through 32 if you'll locator 63. Claims are subject to all processing edits. If all requirements are met and a provisionally affirmed decision was issued, then a payment will be made. If a non-affirmed decision was made, Medicare will not make the payment on that claim, and a denied claim based on a non-affirmed decision will constitute an initial payment decision, and the claim's regular appeals processing will apply. But remember, you want to go ahead and submit as many times as you can, resubmit to get that. If it's something that you simply do not have the documentation and you know it's not ever going to get through, you would then be able just to get that denial and go ahead through appeals if you think you can appeal it. All right, so that is PCR in a nutshell, the pre-claim review choice that's given. So for those of you that are Illinois providers, you'll notice that not much has changed with that. However, the new choices are really what all has changed with the review choice demonstration. So we went through PCR, and then you have choice number 2, which is your post-payment review choice. This is still in your initial review choices, and the post-payment review option simply means you have 100% of claims that are reviewed upon submission of the final claim. Once that claim is received, an ADR will be sent to you, and the home health agency will have 45 days to respond, and the MAC will have 60 days to review that documentation and make a decision. Of course, just like a regular ADR, if no response is received, then an overpayment is initiated. So with pre-claim review, it is pre-payment. You're sending that information in. You're sending the information you have up until that point that you send it. Again, one of the questions we get a lot is what happens in pre-claim review if I don't have therapy, but it's added at the end. Not a problem. If you've already sent your pre-claim review in, you just put the therapy on the final claim. Make sure, though, that if therapy was added at the beginning, that you are putting that on your PCR, because if CMS notices a trend that you constantly have therapy on the end, it may flag. So we want to make sure that whatever you have the documentation for or the orders for, it is going on that PCR as soon as you can submit it to us. So that's prepayment. Post-payment review, this choice is post-payment, meaning 100% are all going to be reviewed. It's an ADR is sent just like you have had in the past, and you would send that information in after it has paid. Then you have a third choice, which is your minimal review. The minimal review is a 25% payment reduction on all payable claims. Claims are excluded just like all of the choices from the MAC Targeted Probe and Educate, or those TPE reviews. But providers who make this selection may be subject to the recovery audit or the RAC contractor for review. This is the one that makes you remain in this option for 5 years. So if you choose this, you will remain in this. You cannot go back in 6 months and make a different choice. This will keep you in this for 5 years. So this is what I call like the business as usual. You just like you always have been. You have your intake procedures. You submit your final claim. We look at it, and the only difference is when claims come in and we make that payment, you're just automatically getting a 25% reduction. So they're not looking at it for medical review, but you're automatically on every claim getting a 25% reduction, and you have to remain in this for 5 years. When you make this choice in your e-service selection, it will have a box that comes up that says, are you sure you want to make this? Because this is one of the ones that keeps you in that for 5 years. So we want to make sure that you are making the correct decision. So those are your initial review choices. Your choice 1, pre-claim review. Your choice 2, post-payment review. And your choice 3 is your minimal review with that 25% reduction. So we talked earlier about if you meet a 90% or greater affirmation rate, which you will get every 6 months, you'll be able to go in and see if you have met for subsequent review. You would then be able to make 3 different options. Those choices are to stay with PCR, so you can continue participating in PCR if that's what you'd like to do. It's the same information as before. Or you can choose choice number 4, which is your selective post-payment review. Under this option, a selective post-payment review of a statistically valid random sampling of claims of at least 30 claims are going to be pulled every 6 months. So again, this is post-payment. So you're going to get this information, you're going to send that wrap into us, you're going to send your final into us, and we are going to pull at least 30 claims based on your claim submissions. We'll pull those and we'll send out what is like a regular ADR to you for those 30 claims. You will send that information to us and we will pay just like with an ADR. This is the other one that makes you remain here for the duration of the demonstration. And again, if you make this choice, a box will come up asking you if you are sure you want to make that choice as well. So there are 2 that make you remain in this. One is in the initial and one is in subsequent review. Your last choice, choice number 5, is your spot check review for subsequent review options. This is no reviews are conducted other than the spot check of 5%. It's a minimum of 10 claims during a 6-month period to ensure continued compliance. So same thing. It is prepayment though. So you would send in your wrap, do your normal intake, send in your wrap. You would then, during that time frame of that provider, we are going to send in, or we're going to send you a ADR. You're going to go ahead and submit for your final. So you're going to send in your wrap, send in your final. We're not paying the final until we send in the ADR for 5%, just random 5% of those claims, minimum of 10. You'll send in that information and we will review it and pay accordingly. So for those options that are evaluated every 6 months, the claims or PCR requests reviewed will determine your results. So in other words, whether or not you meet that 90% or greater threshold, that is a review that happens every 6 months. The evaluation period actually occurs during month 7. So at the end of month 7, providers will then be able to select your new option for that 2 weeks. If you want to change your option, you would just go out there, make your selection, and hit save. There are a few enhancements made since the review choice demonstration. One of them is the RCD status tool. This, if you will look, this is a web-based tool, so it is not through e-services, meaning you don't have to sign in necessarily. You would just go to our website. So anybody in your organization that has your PTAN and your MPI would be able to look at this information. You can put in your PTAN, your MPI, and you would simply hit search. If you will notice, about halfway down, there's a little timer on the right-hand side. It says 9 days left in current choice period. This will tell you if you're wondering, hey, when do I get to make a new selection? This tells you when you can make that selection. This is also that history screen that I had talked about earlier. If you notice at the bottom, it says history. It will tell you the choices that you made, the dates that they were made, even the time they were made, and who made that choice. So you're able to keep track of who is making those choices or who made whatever choice when. We also have another web-based tool, which is our PCR status tool. Same thing, you'd go through the MPI and PTAN number, pull this information down, and if you can see at the bottom, it says a list of the UTNs. So let's say you're trying to figure out, I can't remember which UTN was for what, or if this was the final one, or if this was one I need to put on a resubmission. You'd simply be able to pull this information, and it shows you all your UTNs that you have, and you can hit select next to each one. By hitting select, it pulls up that UTN, and it also pulls up the information about it. So this one, as you can see, has a green bar across it, and it's saying it's provisionally affirmed. So this one is good to go. It even gives you the codes, the G codes underneath on which ones were affirmed. So you know that this is a provisionally affirmed, which provisionally affirmed means fully affirmed. So you can go ahead and put this UTN on a final claim and submit for payment. You can also choose select another UTN. Go ahead and bring up whichever one you want next. If you notice on this one has a red bar across it because it is saying it was non-affirmed. It also gives you which of those G codes you were non-affirmed for. And if you notice at the bottom, it gives you the education that I was talking about. It gives you why it wasn't affirmed and even the publication in that IOM and the chapter, so you can go back and look to see why it wasn't affirmed. This is the same information that the nurse reviewer will be calling you about. So they will call you based on this information and walk you through the information that would be needed. CMS does offer some resources out there about that Paperwork Reduction Act, which is where we are now trying to get that information on they're getting their PRA approval for the RCD program. But if you have other questions or you want to look at the Paperwork Reduction Act or whatever, you can go out here and pull these links and go ahead and look for any information you want. Palmetto GBA also offers an RCD page, which is palmettogba.com/RCD. This is where we put all of our information, including our education events that are coming up. I have already conducted face-to-face workshops in the state of Illinois, and I just finished up in the state of Ohio. Next in January, we will be in North Carolina, and in February I will be in Texas and Florida, I believe. We do have a provider teleconference coming up in January at 10 a.m. Eastern time on January the 9th. This is open for any providers. That information is out there. You can go out there and ask any questions you have about the RCD program. And then on January 16th, I do this same type of webcast at 10 a.m. Eastern time as well, and that information is out there as well. If you're a Florida provider, the Home Care Association of Florida is hosting the January 24th conference in Orlando. It should be out on their website, and we will be doing face-to-face presentations at that as well. There are several ways that you can keep up with RCD. If you're on our listserv, make sure you go out there and click RCD if you haven't chosen that already. You can also find us on Facebook and follow us on Twitter as well. So that was a brief overview of the RCD as a whole, and that pretty much concludes the presentation. So Stephanie, I'm going to go ahead and turn it over to y'all if y'all have anything that you want to ask.
Wonderful. Thank you, Krisdee. Excellent presentation. I don't know how you managed to share all of that knowledge so quickly and so thoroughly. So thank you so much for doing that. Everyone who is on the line, just so you know, we will be sending out a recording of the webinar as well as the presentation slides. So stay tuned to your email. This week you will be receiving all of those documents. If you've had questions throughout the event, hopefully we've been able to address those. Any of those that have not been addressed, we will go ahead and follow up with you after the webinar. Thank you for your attendance, and we look forward to continuing to serve your needs and to sharing knowledge with the industry so that we can all learn and grow together. Thank you.
Thank you for joining our on-demand training today and for choosing Axxess, a provider of innovative, cloud-based software, services, and solutions to help home health organizations improve patient care and grow their business. Axxess is the only healthcare technology company approved to award continuing education credits by the American Nurses Credentialing Center and is also the most recommended home health software on Software Advice. You can watch more on-demand training videos through our software or at axxess.com, where you can also find tutorials, blogs, white papers, and answers to frequently asked questions. Thanks again for choosing Axxess.